I'm Dr. Shalini, consultant psychiatrist on our Mind and Behavior Center. Today we're going to talk about sexual dysfunctions. Sexual dysfunctions is a very important topic in psychiatry. We come across many cases in practice. And when we talk about sexual dysfunctions, we're talking about a person's inability to perform in a sexual relationship as he or she would like to. It can be many causes to that. It can be psychological, physiological, organic causes. It can be generalized or situational. It can be episodic, chronic. It can be acquired as well. So there are a lot of reasons for it. We'll go into each specific disorder. When we talk about male hypoactive sexual desire disorder, it refers to a person's, male's inability to attain interest in coitus or during intercourse. He has an inability to perform or an inability to have that desire, and it should have lasted for a minimum duration of 6 months. That's when we call it a male hypoactive sexual desire disorder. It can be the causes can be varied. It can be due to many issues like unavailability of a partner. It can be due to it can be seen in up to 2 to 6% of men, 2% in the 16 to 44 age group, but generally increases as age goes up. As in the 64 to 66 to 74 age group, we find an increase up to 40% of men. So that can be due to unavailability of partner. It can be causes can be psychological. It can be due to health issues. Varied causes can contribute to this disorder. When we talk about a female sexual desire disorder, arousal disorder, we are talking about women who are going through inability to experience arousal or orgasm during the intercourse, because generally it might be, the reasons may be varied. It might be because they are unable to obtain that satisfaction with the partner. It can be the psychological causes can contribute to this. It can be because of stimulation. In spite of stimulation, they are unable to have that interest or arousal as required for a fulfilling sexual relationship. Causes can be many, and it can be life stresses, aging, menopausal age. All these things can contribute. Maybe the affinity towards a sexual partner. All these things, psychological closeness or emotional proximity to the partner, and things like this might contribute to this difficulty in arousal. So the main cause is psychological. Organic causes can have to be ruled out as well. When we talk about male erectile disorder, when we come to erectile disorder, approximate percentage in men, it used to be referred to as impotence historically. When we talk about it, we talk about acquired and situational male erectile disorder. In acquired male erectile disorder, the person has not been able to achieve coitus in any throughout his lifespan. I mean, in situations, whereas in situational, acquired male erectile disorder is able to have not have had a satisfaction in intercourse. So it's in obtaining erection during any one of whenever he's had had contact. Whereas in situational erectile disorder, is able to have coitus in certain circumstances, but not in others. Say, for example, he is able to have it with maybe a sex worker, but he will not be able to have it in a regular relationship. Acquired male erectile disorder, the lifelong rates are only up to 2%. But generally, when we come to OP patients, up to 50% of sexual dysfunctions come under erectile disorders. Causes can be varied. So it can be organic, it can be psychological. There might be a psychological basis for this. And generally, as the age goes up, we find a predominance, an increase in the percentage. That could be due to, again, unavailability of partner. It can be health issues. It can be neurologic, vascular, or endocrine issues can contribute to this. So again, male erectile disorder, there is a psychological basis to this disorder as well. When we come to a female orgasmic disorder, again, the woman is not able to have coitus or penetration with a regular partner. The causes may be varied. Female orgasmic disorder, there can be many causes to not being able to attain erection. I mean, attain orgasm, because first of all, some women, they might be able to have it in masturbation, but they might not be able to succeed in a regular relationship. They might have difficulty in attaining orgasm. So that could be causes, again, are psychological. There might be an inherent hostility towards men, or their fear of impregnation, or they might have not been in a regular fulfilling relationship. There might be underlying fears might have contributed to this condition. Again, in male, we come to male disorders, we talk about delayed ejaculation or retrograde ejaculation, where the cause can be organic, and generally what happens is he is not able to proceed with the ejaculation in certain circumstances. So that is known as a delayed ejaculation disorder. We come to premature ejaculation disorder. Again, the person, the male, is not able to, the ejaculation occurs in approximately 15 seconds. Before penetration, it occurs. It's known as premature ejaculation. So approximately within 15 seconds to 1 minute. So that is the time span in a premature ejaculation disorder. So what happens in these disorders is that, again, in early ejaculation, if we talk about in mild cases, the ejaculation can occur within um, 15 seconds to 1 minute. But in severe cases, within 15 seconds of penetration, the ejaculation would have occurred. So as soon as the contact happens, within 15 seconds to 1 minute of penetration, in premature ejaculation disorder, the ejaculation would have occurred. So it causes difficulty in prolonged, in a regular sexual relationship. So that is premature ejaculation. Then we have genital pain disorders, where we have dyspareunia, vaginismus, cases where there is pain involved. In cases like women, they have cases of adenomyosis, endometriosis, myomata. In such cases, there is a lack of, in menopausal women as well, lack of vaginal lubrication. So the whole act of the intercourse, the whole contact, might end up being painful. In vaginismus, there's a thinning of the vaginal mucosa, so there's a pelvic tightening. So that also contributes to the pain. There are certain conditions like prostatectomy, in cases where surgery has been done as well, which contributes to the pain during intercourse. So sexual dysfunction can be caused due to that as well. Due to general medical conditions like post-surgical cases or medical cases. In post-surgical cases, mostly myomectomy, hysterectomy, prostatectomy. So those conditions, again, there is pain. The person experiences pain during the act, during the sexual intercourse act. So these all contribute to that. So generally, when we come to sexual dysfunctions, treatment is, we have a psychological basis. So the entire unit, marital unit, is treated as the whole unit is treated as a dyad. So when you're treating the sexual dysfunction, you're treating the entire couple. So the person with the sexual dysfunction has included with the partner in the treatment. So psychotherapy is a mainstay of treatment. We talk about dual sex therapy, which is introduced by Masters and Johnson, where the dysfunction is addressed and the inherent fears are mostly addressed. What are the fears causing or creating the distance between the couple or causing sexual dysfunction? Those fears are addressed, and generally the person is treated as a unit. The entire couple is treated as a unit. So both partners have to contribute to the treatment. And it can be because underlying fears of not able to performance fear, all these things contribute to it. So the psychotherapy aims to correct those distorted thoughts about it, or distorted views about sexual contact. So this is a very effective treatment modality, including it has to be a prolonged treatment, and people, they are encouraged to act on their fantasies and role play. All this is encouraged during therapy. That is one way. And then again we have pharmacotherapy. Generally includes drugs like sildenafil, which is a nitric oxide enhancer, which increases blood flow to the penis during an erection. But there are side effects. In women, it cannot cause vagina. Without vaginal lubrication, it might not be effective. And at the same time, it also has side effects like headaches, flushing, dyspepsia. All this occurs during use of nitric oxide enhancers. So this is a long mode of treatment when we come to sexual dysfunctions. We have to find out what are the inherent issues, coping issues, or whatever the underlying fears are that each partner in the relationship might be experiencing. So it is a long-term treatment, but it can be addressed if taken for treatment and counseling and therapies, along with pharmacotherapy, along with psychotherapy, goes a long way in addressing these issues. Thank you.